Your Health is brought to you in part by Intermountain Healthcare and the Utah Department of Health.
Okay, today we have registered nurse Melanie Livingston here from Utah Valley Diabetes Management Clinic, and we're talking about gestational diabetes. And this is it's a temporary thing, right, for pregnant women?
Right, absolutely. So any woman can be diagnosed with gestational diabetes. There are certain risk factors involved that increase your chance of getting gestational diabetes, but gestational diabetes, we hope and usually see that it does resolve after pregnancy.
Okay, some risk factors here. If a woman is over 25, overweight, when they start, before they're pregnant?
Yes.
Okay. Immediate family with diabetes might increase your risk, and also certain ethnic groups. What ethnic groups are more at risk?
So Hispanics are more at risk, and Native Americans, African Americans, Pacific Islanders, and Asians.
Okay. And there's a test. There aren't any symptoms, you don't know, but there is a test that you all have to take when you're pregnant.
Right. You should be screened between 24 and 28 weeks of pregnancy because there are no signs and symptoms, generally speaking. And if your glucose tolerance test screening comes back abnormal, then you should go ahead and get treated for the gestational diabetes.
There are things you can do. And if you don't get treated, if you don't know you have it, there could be harm to the baby.
Right. There are risk factors with unmanaged gestational diabetes. Some of those risks are premature delivery and stillbirth.
Right.
Also, there is the chance of having an unusually large baby, preeclampsia for the mom, which leads to high blood pressure, which unmanaged also is a life-threatening situation.
Okay.
So there are serious complications.
Okay, so follow the rules. When you start your appointments, you're supposed to have your 13 visits with the doctor before the birth of your baby, and this is just one of the tests you should do.
Absolutely.
Okay, well, thank you so much for coming in and talking about it today. If you ever have any questions about it, you can go to our website, KUTV.com, and click on the Baby Your Baby or the Check Your Health icon. It'll get you all the answers for pregnancy and raising kids. Chase, over to you. Let's head outside and